Hello, everyone. Hello, everyone. This is Tikva from Homeopathy for Humanity. And today we are going to talk about the actual concrete treatment of people who need help with their mind and their mood. So if we look at aphorism 210, it says of sporic origin, or almost all those diseases that I have termed one-sided, which appear to be more difficult to cure in consequence of this one-sidedness, all their other morbid symptoms disappearing, as it were, before the single great prominent symptom. Of this character are what are termed mental diseases. Okay, so he just says these are bodily diseases, they originate from spora, and that they can be difficult to treat because sometimes the physical symptoms disappear into the background. Now, we're going to see a lot of cases in actual daily practice where there's a mixture of physical symptoms and mental emotional symptoms. So a lot of people come to us and say that they have anxiety, that they have depression, but they will also have physical symptoms. Only the very, very sickest people will have no physical symptoms. I currently have only one case where there's no physical symptoms. And that person has developmental delay and schizophrenia. He has no physical symptoms, none that I can find, other than what I can see through observation. But your run-of-the-mill patient that comes and sits with you in your clinic or over your Zoom is going to say, yeah, they're worried a lot, they have anxiety, they can't sleep at night, they're worried, they have various fears, their mood is bad, they feel sad all the time, they cry too much, but their physical symptoms don't usually disappear because it's not usually that severe in my experience. Now, that might be a different experience for people in India. People weigh in.
Same it is, ma'am. There is not much difference.
Yeah. So while it says in aphorism 210 that it's one-sided, it's not really necessarily one-sided because maybe, when people went to the insane asylum back in Hahnemann's day, maybe it was one-sided. But nowadays it tends to be more of a general ailment, but it is spora. Okay, so our anti-sporic remedies are very, very, very important here. Now, occasionally, at the beginning stages of a mental or emotional disease, sometimes there's a shock, a fright, or some kind of severe illness that will need to be quelled by one of the general class of medicine. For example, maybe somebody will need Ignatia or belladonna or something like that at the very beginning of treatment, which can then lower the level of intensity and then make it easier to prescribe the appropriate antisporic or antisporics, depending on, what presents. Because some people will need, let's say, like pulsatilla. Let's just give pulsatilla, for example. It's not unusual to use pulsatilla, especially in the beginning of treatment, because, it's a very, very good mood and hormone regulator. But it belongs to the general class of medicine. So often, go ahead.
No, I just wanted to ask because I had a case in front of me. In those kinds of cases you mentioned, would the symptoms of pulsatilla be more noticeable than the antipsoric symptoms also? Because I observed the case recently and I thought, oh, she really needs pulsatilla, but she has mental health issues. So then I thought, oh, but she actually needs an antipsoric, but I don't know what she needs because I didn't take the case. I was just observing the person. So I guess we are guided by the vital force in those instances as well.
Exactly, because
Okay.
the fundamental rules are still the fundamental rules, no matter what kind of illness it is. If the presentation is clearly pulsatilla, or
Yeah, yeah, yeah.
clearly ignatia, or clearly belladonna, or whatever, in the first instance, we want to give that medicine. Later on,
Okay,
we
okay,
need
okay.
to follow up with something else, because do we remember what happens if we do not follow up with the antisporic? There's a whole aphorism about it.
Yes, Sigma, I have a
Well,
question.
nothing good
Sorry.
happens.
Sigma, can I ask you a question?
1 minute.
Hello?
Hello.
Yes,
We can't hear you very well.
Oh. Yeah, this is,
Who
yeah,
is
no,
it?
it doesn't work. I have a question. I'm sorry if you can't hear me well.
Oh,
You
hi,
were speaking,
Devera.
hi, it's interesting that you mentioned Pulsatilla because you remember that lady that Francine and I are treating with that she had the psychotic episode? We gave her
100%.
Pulsatilla and then we followed up with Calcarea and she's been doing amazing for over a year. We're actually have to meet with her like emergency tonight because it seems like she has some sort of slipping back into a psychotic episode again. And it would be,
Oh.
I don't know what she needs, but from the little that I know, it's pointing back to Pulsatilla. Does that sound, what do you do in a case like that?
Give the pulsatilla again if it's clearly indicated.
So why doesn't the anti-psoric hold, I mean, it has kept, she's only been on a 30C, by the way. She never even went up to 200 yet. And
No.
I don't think she needs the 200 because it seems like she went past the Calcarea. You know how they say Cal feels like they're gonna go crazy?
Mm-hmm.
I think maybe she passed that.
That happens.
So does that
Just
make
go
sense
with
to
it.
go back to the general class of medicine?
Yeah, if you see clearly pulsatilla, I would repeat pulsatilla.
Okay.
And try to find out, if there was a trigger.
Yes, yeah, I will definitely. I know that somehow all her emotions from childhood are coming back, and that's what the trigger was. I don't know why all of a sudden those emotions came back.
Mhm. But you're doing a good job with that case.
Yeah. So far,
Yeah.
I hope it continues. We'll see tonight.
Yep, God willing, it'll continue.
Yeah.
Yeah, so just go with what you see, and then, see if the antisporic presents again. And then when we talk about using an antisporic medicine, we're using it according to the proving data. Like, Sanjay, are you there?
Yes.
Sanjay? I sent you a PDF.
Sanjay. I guess not.
Okay, I sent him a PDF.
He made a little excuse that he's coming.
Yeah, okay. I
Okay.
sent him a PDF.
Hello?
Anyway. Oh, there you are. You got your PDF?
Yeah.
Okay. Can you pull up Lycopodium in the PDF?
Yeah, but you need to allow me screen share.
Oh, right. We got busy talking. Yeah, so it's really important to know how we are going to use how we are going to use proving data here, because lots of times there's like a fixed personality picture that isn't going to match. And
Okay.
might not have the medicine that you need for the person. For example, I pulled up the and made a PDF, and I've got the first medicine here is Lycopodium. And in symptom number 60 in Lycopodium, it says, as
Okay.
if insane, she seeks for quarrels, makes ungrounded reproaches, abuses most violently, and beats the person who she abuses.
Okay.
No, that's not, and then we have insanity and fury, breaking out in envy, pretension, and ordering others about. But then we have insensibility to external impressions and indifference in the highest degree. So when we think about the rubrics under mind indifferent, we're not necessarily thinking about Lycopodium, nor are we necessarily thinking about Lycopodium in quote unquote name disease mental illness. But when we have a presentation where we have 65, 66, 67, we have a bunch of emotional liability. We have simultaneously inclined to crying and laughing. Okay.
Mm-hmm.
And then in 65, 67, 68, after being anxious, there's a great inclination to laugh about trifles for several hours, and then weeping for half an hour without cause. Then we have over merry. Merry means happiness. So we have boisterous, whirling giddiness. But we also have insensibility, insensitivity, and indifference. We also have fury and anger. And then we have, when anyone looks at her while relating a serious matter, she has to laugh. Now, this is also in Graffiti, laughing about serious matters. And then 71, 72, involuntary whistling and humming tunes.
Mm-hmm.
So we have a lot of roller coaster of moods here in Lycopodium. We might not be thinking of from that personality picture. We think of it, we think about it as kind of like an angry person, a person who doesn't like people very much. But there's also that, you could really be looking at like a named disease, bipolar disorder.
Yeah.
See, everybody see that?
Yeah.
How we might be looking at named disease, bipolar disorder in Lycopodium.
Definitely, yeah.
Mm-hmm. So we have
Indifference over Mary.
Right. So we have somebody who might be really depressed, who then goes into anger and obstinance and, quarrels with everybody, who can then become indifferent, not talking to people, and then the emotional liability, the changeability with the weeping, the laughing, going back and forth. So we really can look at this as perhaps one of the indicated medicines for named disease bipolar disorder, not to mention the fact that, anybody who has any kind of mild to moderate depression might need this medicine. Anybody who has any kind of, anxiety disorder. I mean, this is like people who need Lycopodium often have anxiety. You see, there's quite a lot of anxiety in Lycopodium. And then we have this peevishness and the disagreeable occurrences in former time, which vex her even at night when she wakes up. Okay, so we're really discontent, irritable, and then bringing up and ruminating. This is something that a lot of people with anxiety do, is that they ruminate. They think the same thing over and over and over and over and over again. See that in Lycopodium, especially thinking about things that happened in the past. So we have in symptom 45, 46, 47, she thinks of a number of disagreeable occurrences previously, which make her angry even in the night when she wakes up. So we don't want to, the point I'm trying to make is that we don't want to get stuck in the personality picture. We want to go with the proven data.
Yeah.
See, violent and irritable. But we also at the same time have, you see this quarrels with absent persons in his mind.
But I had a question about that because I don't know which aphorism that is. I would have to check. But I know in one aphorism it is said that we have to look at the totality, but we also have to look at the modalities of the person mentioned in the aphorism 5. So my understanding of that was, okay, so we look at the totality, but since aphorism 5 says we have to also look at the spirit and personality, then maybe in that sense, the Kantian thing, maybe according to that, the Kantian thing kind of makes sense, if you know what I mean.
Well, the Kantian thing does make sense to a certain degree. You know, we're comparing the previous state to the current state.
Yeah.
But the current state might have been progressing over a number of years. And so if we're going to see somebody who's quarreling in his mind or with an imaginary person, with somebody who's not there, you know, that's going to be such an important symptom that it's going to be fulfilling. It's going to fulfill aphorism 211, that this holds good to such an extent that the state of disposition chiefly determines the selection of the homeopathic remedy, being a decidedly characteristic symptom, which can least of all remain concealed from the accurately observing physician. This is not about what this person tells us, it's what people see. It's what we observe. So if we see somebody who is raving about somebody who's not there, we see that in the proving data, and that might rule our case, at least in the beginning.
Okay, got it. I mean, I agree, because the totality is the most important thing, right? And the characteristic symptom.
Yeah, but when we see something really interesting and really unusual and highly characteristic, that's way more than the sum total of whether or not somebody likes coffee or they like tea, whether or not they prefer sweet food to salty food. We're looking at something here that's in the proving data that is intense and is overriding other things.
Okay, I think I understand.
Okay, let's try some other examples by, let's say, looking at calc.
Yeah.
I'm sorry, Tifa, can you explain again? I'm sorry, did I cut you off, Ivona?
No, it's okay. It's okay.
Sorry.
Don't worry.
All right, I'm sorry. Can you explain again, when do you, because I had learned, which I really, really like, that we take just the facts, but then at the end, when you look at what remedies come up, that the mind tips the scales. That's how it's sometimes easier to choose the remedy. So, but what were you saying? At what point should we use maybe the Kantian approach?
Oh, I wasn't recommending the Kantian approach at all. What I was referencing was comparing the previous state, aphorism 5, to the current state, aphorism 6.
Okay,
But then
the
when we
change.
bring in aphorism, right? Then when we bring in aphorism 211, this change in the mental state
Mhm.
is
Right.
good to such an extent that the state of the mind and disposition often chiefly determines the selection of the homeopathic remedy as being a decidedly characteristic symptom, which of least of all remain concealed from the accurately observing physician. So let's say we use this example again of the patient who is ranting and raving with a person who is not actually in the room.
Right, so you're
That
talking about
is
real mental disease here.
exactly,
Yes,
yes.
that's the topic, yeah.
Right, but there are times that we take a case that there's not, many times that there's not mental disease, and like Rona was saying earlier about Sepia, that her mother was, it was such an obvious, you know, sometimes it
Yeah.
really is very,
Sometimes it
very,
is.
yeah.
Like, Lycopodium, there's like, weeps when being thanked. That's true. Some people who need Lycopodium wept when being praised or thanked. It's true. But then when it's something small like this, we have to place it with the other thing.
Mhm. Right.
But when we have something that's like huge in a mental, emotional state, that they're clearly not okay, then that's when it can really overweigh something.
Okay, that makes sense. That if there's a really big problem in the patient, that we need to pay attention to that and put it as a primary thing we want to remove inside of a totality. That's actually quite rational, right? If
Yeah.
we deduct it like that, so we don't ignore that
No,
and look
no.
for food interests instead of that.
Right, because some people will get, caught up in, the generals,
Yeah.
or maybe they'll have something, like they'll worry about, their health.
Okay.
But there's a lot of worry about health in a lot of the proving data. Calc has it, Lycopodium has it,
Yeah.
Arsenicum has it.
Arsenicum. Yeah.
Calc even has it stronger than Arsenicum.
Yeah, Calc has it the strongest, I think.
So how we rank our symptoms is really
By
important.
intensity?
Yes, intensity. It's like, okay, here, if we look at the Britacarb, Sanjay, did you ever pull up that PDF?
1 minute.
Let's look at Britacarb for a second. Britacarb is, I think, an underutilized medicine because people always think of it as, for developmental delay, which it can be really great for, but not only. Because look, misanthrope. And this
I
is an
think you
interesting,
should be, Sanjay, I think you, oh, it's here, sorry.
this, oh, no, I have
Okay.
Not in alphabetical order.
no, sorry, my PDF making skills are not that good.
No worries.
What happened?
Nothing.
So we have dejected and not wanting to speak, dejection and unsociableness, right? Now we see this a
Yeah.
lot in a lot of antisporics. This is pretty common.
Yeah,
But
dejection
grief
is a common word.
grief at every trifle is interesting. And then this
Yeah.
evil forebodings come upon his soul,
Oh.
as if a friend might suddenly have fallen fatally ill. And then here's a hilarious
Oh.
one. Okay. Proving number 10, 11, 12, 13, 14. Okay. Okay, anxious and fretful. A little noise in the street seems to him at once like fire alarm, and he is frightened by it, so that it darts through all his limbs. Or the greatest irresolution proposes to himself a brief journey, and as soon as he is make his preparations, he is sorry for it and prefers to stay at home. And this is really,
Mm.
really because one of my kids actually had this symptom. And to
Okay.
prepare for an activity, he'd want to go somewhere, he'd want to make a trip, he'd make the plans for the trip, it would come to be the trip, and he'd be like, "Shh, I don't want to do the trip." And so he called it trip reluctance disorder. So it's just funny, these little things that you see, but people only think about it in, I mean, this child that that I have is, thank God, perfectly normal and intelligent. But this trip reluctance disorder, it's real. It is.
Hmm.
Okay, so we have long wavering between opposing resolutions. Should I do this? Should I do that? Should I do this? Should I do that?
Mm. But that seems to be a common symptom with mentally ill people.
Right, which means that it might have more utility than what
Yeah,
people are
then we think. Definitely.
And children that don't play, okay, either that child has been scared into not playing, or there's something not right there. Because children are supposed to play. Okay, and then we have this sudden, excessive, quickly transient burst of anger and wrath, even to rage from a slight cause, easily provoked to violence. Then look, we have mirthfulness passing over into wantonness. We have, again, that polarity. We have that excessive mood, extreme mood of happy and fun, and then it just goes sideways. And then we have
Okay.
forgetfulness, but that is so common in people.
Yeah.
But
But
when
it's
we look
it's a bolded symptom, so it seems to be important.
but all these can be important.
Okay.
Now look here at nitric acid. How often does anybody think to give nitric acid to somebody who has anxiety?
Not really. I mean, I would if my totality would say so. I really would. Because I really don't like the Kantian philosophy. I think it's really two-dimensional, and it really makes people seem smaller than they are.
Yeah, because the things can be really much bigger than those things. Like look here
Yeah,
at nitric
exactly.
acid. Okay, we have sad mood without any pain, dejected as if desponding and lost in thought,
Yeah.
sad as if depressed, cannot get rid of his sad thought. Homesick,
Depressed.
depressed,
Homesick, yeah.
downcast mood, not lachrymose. That means not tearful, not crying. So we're depressed with a downcast mood, but not crying. But the very next symptom is crying a lot without cause.
Mm.
And then we have very easily moved and inclined tears.
But how can that be at the same time?
Well, no, it's just the next proving symptom. So
Okay.
any of these presentations might be a nitric acid. The person can
Okay,
be
got
sad
it.
without having any actual pain. They can be totally despondent, lost in their thoughts. They can't get
Okay,
rid of
okay.
their sad thoughts. All these things are individual possibilities.
Okay.
But you see here,
But
number two,
they seem, but now they're all starting to seem very similar to
they
me.
are. That's why we pick out when we have a case of mental illness, name disease. We're
Yeah.
gonna pick something here that is so indicative and is solitary in this. So she falls to thinking over an anxious occurrence long past and cannot rid herself of it. It is almost as if waking in dream. From time to time, she, as it were, awakes from it startled, but is always absorbed.
She falls to thinking over an extra almost like
Again, by these ideas, without being able, in spite of strenuous efforts, to think of anything else. So you've got somebody who's thinking over something bad that happened, and she can't get out of it. She's so stuck. She or he is so stuck in this bad thing that happened long ago. It's almost as though she's in a dream state. And from time to time, she startles out of it, but she then goes back into it, despite how much she works at thinking of other things. You clearly have a mental state here that would be handed over to a psychiatrist. She is thinking of something that happened. She can't get over it. It's like she's in a dream. She's stuck there. And from time to time, she seems like she startles out of it, but then she goes back. And in spite of how much she works at trying to change her thoughts, fix her situation, how many Louis Hay books or meditations, no matter how many things she does, she's still absorbed in that thought, no matter how much effort she goes to. That is so clearly in nitric acid.
Okay.
But when people think of nitric acid, they think, anal fistula, hemorrhoids, right? What do we think
Yeah,
of
so
when we think nitric acid?
they taught us in college that they're like personality profile is like this really angry, vindictive person that will like sue you for whatever you do, but they never mentioned this aspect.
Yeah, so in
Yep.
proving number 45, we have easily excited annoyance, which much affects the mind. So there, we have our ill humor, taciturn, discontented, peevish. So yeah, but we can look at a bigger picture by looking at the proving data. And this is an interesting one. Number 51, long continued rancor.
What is that?
Okay, rancor is like being upset.
Okay.
Long continued, emotional disturbance, insensible to apology and excuse. That would be
Okay.
when a person is really upset about something that happened previously, and it doesn't matter how much you try to make it up to them. You can
Okay.
apologize and apologize, explain the situation. They don't care. They're like,
Okay.
I'm gonna cut you out of my life.
Got it. Interesting, very interesting.
Mhm.
Really mind-blowing, actually.
Right, so we can really look at these phoric ailments in a new light.
Yeah, exactly.
Just by looking through the proving data.
Mm.
We have in sulfur. We have some very interesting things in sulfur, like growing thin, right? Or imagining that she gave people something wrong, which might kill them.
Oh,
involuntary hastiness, great distress,
okay, there we are.
cannot fix his attention on the present subject.
What number is that?
That was number 31.
Okay. Okay. Great
35,
distraction.
36, 37, 38 gets vexed, gets upset about everything, takes every word wrong and gets insulted. He imagines he ought to defend himself and get angry. So we see that not unfrequently. So this would maybe be something that we would want to include with other symptoms. But when we have these things that are just so clearly, just like, you know, I don't know how to explain it very well. So when we are talking about aphorism 211, we'll go back to that, that it
Okay.
holds true to such an extent that the state of disposition chiefly determines the selection of the homeopathic remedy as decidedly characteristic, which can lead
Okay.
to being concealed from the accurately observing physician. Okay, so when we see somebody who's raving about somebody and angry and hostile, raving about somebody who's not actually there, that is so clearly stated in Lycopodium that we might give Lycopodium.
Yeah,
even
but
if-
I have to sorry to interrupt, but I have to say that it kind of seems hard to repertorize those kinds of things. Am I wrong?
You're right. It's so hard. That's why our thorough knowledge of proving data is so important.
Oh no, but that's so difficult.
But you'll get there, you'll get there, you'll get there.
But we have like I remember when I was trying to do sepia, I think it was like 1,000 symptoms. Maybe I'm over numbering it, but it was like at least 500 symptoms. It's really hard to go through all of that and like even remember it with that
Yeah.
as well.
Yeah, nobody ever said being a homeopath was easy work. Nobody did.
I wish I had known.
That's what a lot of people say. But just
Yeah.
give the impression here and leave people with the information that this
Yeah,
can
but
be a one-sided disease. And then when you have that one-sided disease, everything else moves to the background.
yeah. So it's
One
easier
minute.
to focus.
Can you see this?
One-sided. Yes. Physical, mental, external, local maladies, internal, mental origin, physical origin. Okay. This is really good. I like this.
One-sided diseases of physical type and mental type. And then physical external symptoms, internal symptoms. And externally you see these local maladies.
Yeah. It makes a lot of sense.
And mental, you see mental origin means mental diseases with mental origin, and mental diseases with physical origin.
Yes. Kahneman talks about that as well. It's really enlightening how some mental diseases are not from Sora, but from bad morals or bad habits or bad beliefs.
No. That is another part. He is talking about the mental symptoms. Mental symptoms which are origin from mental side. and mental symptoms which are originating from physical means corporeal side.
Yes, I know. I'm just saying that in one of the aphorisms, Hahnemann said that some mental illnesses just come from, for example, bad morals.
Or bad lifestyle, or
Exactly.
improper
Yeah, yeah.
education. Yes,
Exactly. That's what I was referring to.
yep, that's true. But it says in 223 that the anti-sporic treatment be omitted, we can assuredly expect from a much slighter cause that brought on the first attack of insanity, a speedy occurrence of a new and more lasting severe fit, during which the spora periodically or continued mental derangement, which is more difficult to cure. So we always, when we do have a sporic ailment with an emotional mental disease, we need to give an antisporic. But it doesn't mean
Of
that it will
course.
cure, because it can, until there's been enough treatment or until there are no more exciting causes or painting causes. It just requires a lot of work to help people. But the help that is available through homeopathy is impressive.
Okay,
how many
that's
people
true. Yeah.
How many people would have not committed suicide had they had a dose of Arum Palate? We have to think about that.
Yeah. A dose of what?
Arum,
Oh, yeah.
that's the #1 suicidal remedy. So that could really,
Yeah, that's really sad.
I know, really sad. Okay. Okay, Gunjan.
Yes, ma'am.
So you see what I'm talking about using proving data?
Little bit.
Little
A
bit.
little bit. I feel the same way.
Okay. Just what? You see what
Yes,
I'm talking about using proving data?
sometimes only. I go
Mhm.
with the pictures mostly and with the repetition. And
Yeah.
mostly I use aphorism 153 and disposition. And in most of the cases, these two things helps me.
Would you like to read that aphorism?
Which one?
Cool.
153?
Yeah.
You are saying to me or to someone else?
You. The characteristic. Yeah, I'm just talking here about how sometimes we see something in the proving data that is completely matches what the patient's need is. And that it can be a real sure director.
When I see, when I have a remedy in my repetition,
You guys
then I read
talk.
Materia Medica.
What's going on?
I don't know. She was going to read aphorism 153 or something else.
Oh, I think she was just suggesting you read it, but okay.
Okay,
Now she's gone.
okay. Shall I read aphorism 153?
Yeah.
Yeah, when?
Okay. In the search of a homeopathic specific remedy, that is to say, in this comparison of the collective symptoms of the natural disease with the list of the symptoms of known medicines in order to find among these an artificial morphic agent corresponding by similarity to the disease to be cured. The more striking, singular, uncommon, and peculiar characteristic signs and symptoms of the case of the disease are chiefly and most solely to be kept in view. For it is more particularly these that very similar ones in the list of symptoms of the selected medicine must correspond to in order to constitute it most suitable for effecting the cure. The more general and undefined symptoms like loss of appetite, headache, debility, restless sleep, discomfort, and so forth demand but little attention when of that vague and indefinite character. If they cannot be more accurately described as symptoms of such a general nature are observed in almost every disease and from almost every drug.
Exactly, which is why we come back to this proving data. So if in our patient, we have proving number 61, okay, let's say we have in our repertorization, we have likely candidates, sulfur, lycopodium, and whatever, okay? But then we see here in 61, 62, 63, she imagines that she has beautiful clothes. She takes old rags for beautiful clothes. She takes a coat for a jacket, a cap for a hat. If we see somebody who mixes up their clothes, wears rags, and thinks they're beautiful things, we're going to use 153 and give sulfur there.
Okay.
Because that's going to be something that's characteristic.
I never understood what that word meant in the context of healing.
Characteristic?
Yeah.
So sulfur has great inclination to philosophic and religious ravings.
Okay.
So if you see somebody who has like a religious mania that takes a box and stands in the park and starts
Yeah.
talking about God and this and that and whatever, they
That's
might be,
characteristic.
that's characteristic.
Okay. Okay.
But a characteristic symptom can come under any of the momenta. It could be in any location. It could be in a leg, it could be in the abdomen, it could be in the head. We're just talking here
Okay.
about when the characteristic is in the mind. Okay?
Okay. Yeah.
When the characteristic symptom is in the mind. And I'm just giving some examples of characteristic mind symptoms. Because all of them have, some kind of depression, some kind of dejection, some kind of anxiety. But then there's ones that are truly characteristic,
Okay. Got it.
override anything else.
Okay.
Like,
I think I got it partially.
okay, Sanjay, you have something to say about this?
About what?
All of this.
See, basically, as according to the aphorism 153, he talks about the characteristic of the remedy. Like in the
I never
same
sat preaching.
contents, in the same content, like he talks about individual. It talks about individualization. Like every drug has its own features, own what you call specialities. Every drug has its own in his and he talks about rare and uncommon. And every time I would like to talk about these uncommon symptoms. What we really mean by uncommon symptoms?
That we don't see often in people. Right?
Right.
Gunjan?
No, which strike us when we see one case, so which strike to our mind, that is the uncommon characteristic symptom,
No,
which
no,
is
no, no.
different from the other.
Something. See, there are these words: striking, singular, uncommon, and peculiar. There are 4 words, and before all these 4 words, Hahnemann has written more striking, more singular, more uncommon, and more peculiar. All
Right.
these becomes characteristic. Whatever
Yeah.
it is characteristic.
Yeah.
They are the chief guidings. Like in alumina and causticum, person passes stool in standing position easily. Passing stool is a common thing, and the normal position is something different. But passing easily in standing position is not common. So here in alumina and causticum, passing stool in standing position is a uncommon symptom. Though it is not striking,
Okay.
it is not rare,
No,
but it is
basically,
not common.
what I mean to say, which has to be like fire will give you normally give you a burning, a sensation.
Right.
And if it is not giving that burning sensation, or ice doesn't give you that cold sensation, it might give you something else that becomes uncommon.
No, I like
Mm.
I really like the fact that you brought up alumina and causticum with the stool better while standing as characteristic, because that is extremely characteristic.
Hmm.
But when we have something that's less characteristic, a characteristic can be made with a modality with something that's more common, or a location and a modality with something more common, or a location
Yeah.
and a concomitant that come together. that
People,
are not
sorry, I'll
common.
have to go now. It's dinner time here, so I need to go. It was a pleasure.
Okay. See you
Nice.
later,
Bye,
Ivana.
guys. See you later, guys.
Yeah.
So yeah, Jishwant, I agree with you about the characteristic like that. But then when we have those
Mhm.
cases that are just kind of, mild complaints and whatnot, we can then
Mhm.
combine something to make something more characteristic, just like how Boninghausen extracts
Mhm.
us, that we can, take the modality to make it characteristic, that we can
Yeah.
take the location to make it characteristic.
Anything can be characteristic. Anything which strikes you, which makes you, which takes you off guard. Anything. Say, for example, there are pimples or acne just on the wings of nose. Recurrent pimples or acne on the wings of nose. Here, acne or pimples are a common thing, but the location becomes important.
Mm-hmm. Yeah,
Location becomes location becomes very important. Or say, for example, there is a ward on the ear lobule. In one case, when I saw warts on genitals, hundreds of warts over the genitals. and with a typical order. Maybe if I have that photograph still in my mobile, I'll share next time. There were maybe more than 100 or 200 warts on the genitalia, which all removed just by 1 or 2 doses of acid nitrate. A typical smell. Maybe if I have, I'll share that case of warts. So warts on genitalia, huge number, so many. They no wart on any other part of the body. So that becomes, warts are normal, but the location becomes very important. Whenever there is a pinpoint issues, pain in a pain is covered by fingertip, or like wandering pains. A person comes and complains, I have pain here, 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 and it as if it is walking here and there. So there I consider wandering pain. So this sensation or this wandering or movement, this becomes characteristic to that case. So
Definitely.
as Tikva, you are saying that anything can become characteristic, that is true. Like in phosphorus and causticum, the rawness of the phosphorus and causticum, when patient comes and I have a rawness here, and another patient says I have rawness here, just rawness is a common symptom, but the location and the way of description makes the change, or it differentiates both. Causticum have linear rawness, phosphorus have general rawness. So this type of expression makes that particular symptom very characteristic. And there may be so many other examples, so many other examples.
One of
If
sorry to disturb. One of my
Mhm.
patient is having a pain in the chest area. She just show it like this. I have pain here and back at the same point. What is the symptom
that
should
can
be
be
taken?
no, that can be the indication of MI. So
No,
that
no.
has to be ruled out.
She has ruled out. It is not like that.
No, you
It
have
is
to go
a
for TMT. Just today evening, I had the same case, and the pain was referring infrascapular.
no.
Like,
It's not
it-
like that. Here one spot,
let
and
me
it is a little bit.
let me complete. I had this evening one case. The patient said, I have a pain here, and it is going back infrascapular. I asked him for ECG and TMT. In ECG, it was normal. Then I said, no, go for TMT. And just half an hour before, I have report. The TMT is strongly positive for myocardial infarction.
Not like that. Just one point over here and
Mhm,
one point at a same point at the back. It's not
mhm.
referring. Okay. It is covered with the fingertip. It is
Then you
like that.
can go for that. The pain in a spot. Pain
Where
in
is it?
spot.
I was not finding it in a repertory.
Acha. Let me tell you
Even
where it
I
can
was
be.
not able to.
Let me tell you where it can be.
In Boning Hussain?
No, I'll tell you. Mm, It can be in combined repertory, Boric, Patak, Murphy, Complete, and Bonigus, and both. In all these, if it is in the head, then there are 38 medicines. If it is in the
It is
back,
in the
there are 12
chest.
medicines. Pardon?
Chest and
Chest.
back.
What? There are 4 medicines.
Will you please tell me what are that and which repertory?
Agaricus bufo netramur senega.
And which
And
repertory is it?
this is Bonninghausen.
Okay,
Pain
fine.
chest in a spot. And again in the chest area, when pain is in a spot and in a burning type, the single medicine is Snega.
This pain refers to gallstone.
This location
If the
doesn't belong
person,
to God.
no, no,
This
no. With
is,
my patient,
pardon?
I'm asking. Yeah,
Uh-huh.
if the patient is having gallstone, it is
Hmm.
a common symptom of gallstone. No, no.
No,
On the
gallstone
right
pain doesn't
side,
come here. It is on the
Oh,
left side. Gallstone will be on the location.
yes, yes, yes. But she is
Uh,
having history of gallstones, and she is
hmm.
complaining. It is since then. It is like,
No,
so
they
then you
may be
need to
both
add that
different
to your
things.
repertorization.
Mhm.
okay. Okay, fine, ma'am.
So today was intended to show that
Mhm.
we can sometimes really find a very, very characteristic symptom inside the proving data that can be
Yeah,
invaluable for our patient when treating this type of disease or any type of disease, because the fundamental principles apply no matter what type of disease it is.
that's true. That's right. That is absolutely right. When we go for the proving symptoms or when we go to the materia medica, as it is, symptoms are found as it is. And those which are as it is, they gives result just when you shoot tuck and when medicine in, problems out. As far as mental diseases are concerned, I have many patients. We have different medicines in acute state and in regular chronic state, medicines are different. But as I have found, mental illness doesn't come in one go. They supposed to have one or two or three times or four times, at least two times. They supposed to have some shocks, some sudden shocks, sudden incidents they're supposed to have. And the gap between two, maybe 6 months or maybe 6 years gap. If the same type of symptoms, same type of shocks comes, male reacts in another way and female reacts in another way. It depends how we perceive the shock or the event. It depends. And once the acute phase is over, then what, as Haniman has said, between 210 to 230, I hope in 225 or 226. As soon as the acute attack is over, give the antipsoric medicine. That will complete the case. Otherwise, that remains. Are we all there?
Yeah, I'm still
Yes,
here.
Ah,
yes, even
so
I am.
as soon as the acute attack is gone, immediately we supposed to give antipsoric medicine. Otherwise, when it relapses very badly.
Yep.
I have few cases of bipolar disorder, few cases of schizophrenia, some other types, some kleptomanics, other manics or insanities, and many of times we commit the fault, and many of times patient doesn't come when patient feels better. They doesn't come up. They doesn't appear, and they just come when the second attack comes.
Mhm.
And at that time, it's very difficult to handle them because second phase may come from different stimuli. Anyway, we had a nice time, good discussion. Hope to continue this mental disease from 2:10 to 2:30. Dr. Sanjay may comment more. Dr. Sanjay, are you there?
I think he left
Yes.
us.
Acha, okay. So, shall we complete today?
Yep. Okay, guys, thank you for
Okay.
the good learning session.
Thank you, and thank you to you for your efforts and everything.
And
Thank you.
hopefully
Good
we'll
night.
be back to Organon aphorism. What are we up to? 41 for Thursday, I think.
Yeah, 41, 40, 41.
Okay. Yep. About similar diseases.
When two dissimilar diseases meet together in an organism.
No, we did 40 last week. Now we need to do 41
Okay,
for this week.
right.
Okay, great. All right, guys. Thank you.
All right.
Have a great evening.
Thank you. Bye-bye.
Thank you,
Namaste.
ma'am. Namaste, sir.